So my name's Clare. I'm a pelvic health physiotherapist, which means I work with women throughout their lives, particularly interested in supporting them during pregnancy and postnatal. So these exercises are really important because the pelvic floor muscles that sit at the bottom of our pelvis are put on increased stretch, and they have to hold the increased weight of our baby during pregnancy. Now, this can lead to certain symptoms such as urinary incontinence. We might experience that during coughing, sneezing, laughing, or when we need a wee and we're trying to get to the bathroom. We know from research that if women practice pelvic floor exercises during pregnancy, this significantly decreases the chances of having urinary incontinence at the end of pregnancy and into the postpartum period. So first of all, I'd recommend starting off with daily pelvic floor exercises. Now, this can first of all just mean that we're getting to know how to contract the muscles better and then work onto more of a pelvic floor program as well. It's really, really hard sometimes to connect with these muscles because we can't see them, but the more we practice it, the easier it's going to become. So first of all, we need to know where the pelvic floor muscles are so we can actually connect with them. So the pelvic floor muscles sit at the base of the pelvis. They make up the floor, which is here. So they come from the coccyx to the pubic bone and then touch on either side. They come around the back passage and then forwards around the vaginal opening to your pubic bone. So for most of us, the best way to connect to the pelvic floor muscles is to first of all think about squeezing around your anus as if you're holding in wind. So just try that now. Think about squeezing on and then letting it relax. I then want you to think about bringing your back passage and squeezing that forwards to the pubic bone, like a forwards movement, and then fully relaxing. So if we now think about it as we're sat up, we're trying to bring the back passage forwards to the pubic bone and then fully release. The releasing and letting go is as important as the squeeze. Now, once you feel confident with how to contract and release the muscle, we can then move on to two different types, short and long. So in the short ones, all I'm going to get you to work on is that squeeze of contracting from the back passage forwards and then fully releasing it. And just try that 10 times in a row. Once you feel confident with that, you can then move on to the longer ones. The contraction is the same. We're now just going to try working on holding. So try now to think about squeezing from the back passage forwards and hold that squeeze for up to 10 seconds whilst you breathe in and out. Try not to hold your breath before you fully relax. Now, if 10 seconds feels too long, feel free to start with 3 to 5 seconds and slowly build up. And you're trying to aim to do 10 reps of that as well. In an ideal world, we would be aiming to do 10 short and 10 long 3 times a day, but you can build up to that through the pregnancy. Just start somewhere, build your confidence, and then go from there. I usually recommend that women start thinking about this in the 3rd trimester, and we can think about how we can prepare both physically and mentally. Practically, this might look like reading books or attending antenatal classes. But from a physical perspective, when you're preparing for vaginal birth, we will recommend that you practice perineal massage from 34 weeks. Keeping active is great for us during pregnancy in so many ways, particularly for our pelvic floor, but all of our muscles as well. Also helping our bowels, but also keeping active helps with our mood, our sleep, and our general strength, which can really help us as we prepare for motherhood. I also recommend working on preventing constipation. Now, constipation is actually really common during pregnancy and it can be quite embarrassing or hard to talk about. The problem is when we're constipated and we're sat on the toilet straining, this can have a negative impact on our pelvic floor muscles. So therefore, we want to prevent constipation to look after our pelvic floor muscles, which obviously then helps alongside the exercises that we're doing. So to do this, you need to think about having enough fluid, so making sure you're getting enough water, having enough fibre. We recommend about 30 grams a day, so it's just helpful to think about across your 24-hour period how much fibre you're having, and also keeping active. Perineal massage is a really great technique to use, and what it's aiming to do is stretch the tissues between the vagina and the back passage. This is called the perineum, and the surrounding tissues. Now, it's been shown in research that if we do it regularly from 34 weeks, it can reduce the risk of us having a vaginal tear during vaginal birth, or the severity of the tear that we might have, or the need for an episiotomy, which is a small cut done by the medical team during birth. Therefore, it's recommended that all women do practice and try perineal massage if they're aiming for vaginal birth. So you want to get yourself into a comfortable position. This might be on your bed with your legs out to the side. Make sure you've washed your hands and you can just use a natural unscented oil. You want to then apply oil to the vulva and to the perineum as well as to your thumb. Then you place your thumb just inside the vagina. What you're going to then work on is sweeping side to side, putting pressure down onto this back wall and sweep 10 times. Once you've done that, you can then think about the area like a clock, 12 o'clock at the top, 6 o'clock at your anus, 3 and 9, and then we're going to aim to stretch in all of the areas of the clock face from 3 to 9 o'clock. So first of all, again, with your thumb inside, you're going to push down towards your back passage and hold this stretch for 30 seconds. It's going to feel a bit stingy and burny, but it shouldn't be painful. You're then going to hold that stretch 5 o'clock, 4 o'clock and 3 o'clock, each for 30 seconds, and then again work up from 6 to 9 o'clock as well. You can do this a few times a week, and gradually over time you might feel that you can stretch a little bit more. If you're experiencing pain during pregnancy, we really recommend that you go and see a specialist, such as the pelvic health physiotherapist like myself. But I'm going to run you through 3 things that you can practice at home whilst you're waiting to see somebody. First of all, pelvic tilts. This is a great movement that helps with mobility of the lower back.
Sitting on a gym ball or the edge of a chair, gently tilt your pelvis backwards before sitting up tall again. The movement should be coming from your pelvis and lower back and not from your upper back, arching forwards. Repeat this 10 to 15 times.
Second of all is a seated glute stretch. Now this helps to stretch the bottom muscles, which can feel and get quite tight during pregnancy.
Sitting on a chair comfortably, bring one leg up to place the ankle of one leg on the opposite knee. Lean forwards from your hips and not from your spine, applying a gentle pressure on the bent knee. Hold this position and stretch for 30 seconds. You should feel this in the bottom cheek of the bent leg. Now repeat this on the other side. Again, apply a gentle pressure to the knee and lean forwards, feeling the stretch in the buttock muscle. Hold again for 30 seconds before releasing and relaxing.
Thirdly is thread the needle. This helps with our upper back mobility. The upper part of our spine can also get quite stiff during pregnancy, but also during motherhood.
Start in a comfortable position on your hands and knees. Bring your right arm through the gap between your left arm and your left knee before rotating and bringing your arm up towards the ceiling. You can repeat this in a fluid motion as shown, focusing on rotating your upper back but not moving your hips.
It can be really helpful from 34 weeks to think about optimal fetal positioning. This means trying to get the baby in the best position before labour. The best position is for our baby to be head down with the back of its head towards our front. And there are a few things that we can do to help facilitate this. First of all, being in upright and forwards positions. For example, spending time kneeling on the floor and leaning over a gym ball.
Rest forwards onto the gym ball as shown. You can spend some time like this in your evenings to help the baby get into a good position.
Secondly, when you are sitting in a chair, thinking about sitting nice and upright and placing a rolled up towel in your lower back. And third of all, keeping active through the 3rd trimester and spending time in upright positions where possible.